My epiphany moment really came about 10 years ago when I recognized that I was headed for my own operating table because I was a morbidly obese pre-diabetic heart surgeon, right? And here I am trying to help people with this, and yet I was headed the same direction, right? And I was following the advice that I had learned to give them, all of the advice that, both of us learned, right? Eat less, move more. And it wasn't working for me and it wasn't working for my patients.
This is Dr. Talks.
Welcome, everyone, to another episode inside of the Heart Attack and Stroke Prevention Summit, where we bring on the best guests to provide you with the information you need to prevent a heart attack and stroke, or to recover from a heart attack or stroke, prevent a second one, whatever it may be. And who better than a cardiovascular surgeon to talk about heart health than Dr. Philip Ovadia? And I've got him on here. His website is I Fix Hearts. We're going to talk to him about this stuff. Phil, I'll address you as Phil during this here, with all due respect. I used to run, if you will, with a cardiovascular surgeon out here in Arizona. And we were both young single guys fresh out of training. And we would be out somewhere and, maybe we'd be talking to, let's just say, a couple of women. And I always deferred to him, kind of like, well, we're both doctors. I'm like, I'm a cardiologist, but he's the surgeon. He's the cardiovascular surgeon. That's the guy. So, Phil, welcome to this episode of the Heart Attack and Stroke Prevention Summit.
Yeah, great to be here with you, Jack. Really excited to have this conversation. It's interesting. I mean, certainly cardiac surgeons, I think, are known for their maybe God complex. And you're probably familiar with the old joke, what's the difference between God and a cardiac surgeon? God doesn't think he's a cardiac surgeon, but I like to think that I'm a little bit more humble. I know many of the nurses and, staff that I've worked with over the 20 plus years that I've been doing this now always comment. They're like, are you sure you're actually a heart surgeon? Because you don't behave like the typical heart surgeon. And, I like to think that sort of humbleness, that open-mindedness, not thinking that I knew it, is allowed me to get to where I am today. And where I am today is increasingly focused on keeping people off my operating table. I think one of the great sort of truths that I've had my eyes open to over the past, couple of years is that the vast majority of what I do as a heart surgeon every day shouldn't need to be done. And this is all preventable disease that we're dealing with. I know you talk so much about that. And, this summit, right? The Heart Attack and Stroke Prevention Summit. And that's what it should be all about. That's what I believe we as physicians should be focused on, is keeping people off of our operating tables as it is and helping them to prevent these diseases rather than just being there to treat them when they occur.
So you're still in the trenches. You're still cracking chests, if you will, still doing bypasses, still doing valve surgeries, all that stuff. But what was your epiphany moment, or I guess, kind of like your superhero origin story about how you go through all this training to be a cardiovascular surgeon? You go through all these years. How do you, what was your moment of clarity?
Yeah, my epiphany moment really came about 10 years ago when I recognized that I was headed for my own operating table because I was a morbidly obese pre-diabetic heart surgeon, right? And here I am trying to help people with this, and yet I was headed the same direction, right? And I was following the advice that I had learned to give them, all of the advice that, both of us learned, right? Eat less, move more, eat a low fat diet. And it wasn't working for me and it wasn't working for my patients. And so I started to ask some different questions, was fortunate to start to come across some different information and really started to learn about things like insulin resistance, things like metabolic health, and what they really have to do with heart disease. And to understand that, again, the way that we were educated, it's all about cholesterol. It's not all about cholesterol. And I was first able to overcome my own health challenges, right? Lost 100 pounds, have been able to maintain that weight loss for a long period of time now, reversed my pre-diabetes, and along the way came to understand how I could be better helping my patients, like I said, trying to keep them off the operating table, or at least, maybe after they've been on the operating table, addressing those root causes. Because the surgery, right, putting in the stents, doing the bypass surgery, it does nothing to change why the patient got there in the first place. And if you don't address that, they're going to be back. And we know it, right? We've both seen it from our years, working in this field. The vast majority of patients that get treated for heart disease with something like a stent or bypass surgery, they still end up dying of heart disease. Yes, they die later. We've improved their quality of life in the meantime, but they still die of heart disease because we don't address the underlying root cause. And that's what I think we need to have a greater focus on.
All right, so let me tell you this story. Back in 1999, I go to a meeting as a cardiology fellow at the American College of Cardiology meetings, and it's in Orlando. And there they had a debate between the late Robert Adkins of high fat, low carb fame against Dean Ornish, the low fat guy. And Phil, I got to tell you, these guys hated each other. After 45 minutes of debate, back and forth. And I walked out of there and everything Atkins is saying just makes total sense. Now, I was still, a 20-something-year-old cardiology trainee. I was still a Chicago guy. I didn't really follow at that time that type of message, but it's kind of like, your understanding and how you're teaching people. You obviously lost all that weight. How did you do it? And what's the diet you're recommending to people in order to prevent a heart attack or stroke?
Yeah. And, similar to you, one of my epiphany moments was actually at a meeting as well, Society of Thoracic Surgeons I was actually in your neck of the woods in Phoenix, Arizona. And Gary Taubes was the invited guest lecturer, right? And you know how these things are, right? You're sitting there and it's a couple of thousand, in this case, heart surgeons, and they're in a big room and you're kind of looking at the schedule and you're looking outside and, it's nice Phoenix weather. And I'm thinking, what's this journalist like talking to us about? And no disrespect to Gary, and I've met him since and relayed this to him. But I'm kind of like, okay, this is a heart surgery meeting. Why are we hearing from some journalist? But at that time, he had just written the case against sugar, and he started talking about how the types of food that we eat is more important than the amount of food that we eat. And for the first time, I was hearing about these kind of carbohydrates being particularly dangerous, sugar, refined carbohydrates. And so that's what I did, right? I cut out sugar. I went on a low carb diet. Of course, along the way, rediscovered the work of Dr. Atkins and so many others. And, it was right at first, like many people, you're just focused on the weight loss, right? And you're like, okay, great, I lost weight. But then you start to get into the issue around heart disease and heart health. And coming across the work of physicians like Dr. Reven, right? And understanding that Gerald Reven and insulin resistance is the root cause of heart disease. And then I didn't learn this, right? Why this isn't the stuff that we learn in school and in training. And insulin resistance is something I remember, maybe being mentioned in one of those like biochem courses, early in medical school. But certainly, as I was spending every day, in the hospital treating heart disease, never heard insulin or insulin resistance mentioned. And yet, there it is, the root cause of heart disease, probably the most important thing, along with inflammation. So, seeing the gaps in our understanding is really what led me to where I am. And at a simple level, my approach, what I tell people is, first and foremost, we need to get back to eating whole, real food. Right. We can maybe argue about various things in the diet, but one of the things that's most consistent, right? And one of the things that I would say that Dean Ornish and Dr. Atkins would have agreed on, right, was eating real food. And so that's really what I focus on at a high level. Eat whole, real food. I think, for anyone who's dealing with metabolic disease with insulin resistance, right, you can't get away from, you got to lower the carbohydrates. And again, as I look back as to how we got into this mess. What you see is this focus on low fat because of the kind of misguided concept that dietary fat was what was causing heart disease. And you take out the fat and you put in more carbohydrates. And we look at everything that came after that, right? The food pyramid and all of the diet guidelines. And they keep pushing us towards higher and higher carbohydrates and more processed food. And the answer in my mind is pretty simple. Go back to what we used to do when heart disease was essentially non existent. Eat whole, real food, highly refined carbohydrates, again, really non existent or a very minimal part of the diet. Carbohydrates in general were a lower part of the diet, and eating natural fats, animal fats, was the majority of our diet. And that is what is going to prevent and manage heart disease most effectively. And then we have to, the problem today, right, is when you say that, just like Dr. Atkins was facing back then, is but your cholesterol. And that's where we have to start to get into the nuance of what cholesterol is, what role it actually plays in heart disease, and what role it may not play in heart disease. And that just having high cholesterol isn't really the problem. Having the wrong type of cholesterol is the problem. But that again ties back to the types of fat that you're eating and the amount of sugar and processed food that you're eating.
There's a lot of conversation these days going on about seed oils. Bobby Kennedy's talking about it. A lot of people are talking about it. I think, my opinion is that, as you mentioned, whole, real food. I guess in the sense of like, if you're talking about whole, real food, well, seed oil would not be part of whole, real food. But why would olive oil be part of whole, real food? Why would and even coconut things that frankly I think are good, and I like olive oil. I got no problem with olive oil. And my personal opinion regarding seed oils is I don't really consume a lot of it, and I don't want people to be like the big problem here is seed oils when there's all the artificials, there's all the chemicals. So give me your take on like oils in general and you think they come in or not come into play.
Yeah, so that seed oils are problematic, right? But I don't know that they're problematic because of what they are or how they get incorporated in the diet, right? And what I mean by that is they are in processed food. Like you don't get seed oils outside of processed food. So it becomes a little tough to separate those two things. Now, I think there are a lot of things mechanistically about seed oil or biochemically about seed oils, right? The polyunsaturated fatty acids and those unstable bonds that are then prone to oxidation, right? And you can see on a biochemical level how these can then lead to the inflammation, the reactive oxygen species, that we can demonstrate are then leading to the blood vessel wall damage and the subsequent buildup of plaque in those blood vessel walls. Again, I kind of like you mentioned, right? If you're just eating whole real food, you're not going to be exposed to these things in large amounts. I prefer, when we're talking about fats in the diet, I think that the natural animal fats come first and foremost. I think that the plant fats that are easily kind of extracted, right? Things like coconut oil and olive oil are fine. When you start to get into these, highly processed fats, and that's what they are. The seed oils are just another processed food. They're what happens when you highly process fats, just like sugar is what happens when you highly process carbohydrates. And I view them both as problematic. And I believe that we should be minimizing all of this in the diet and just getting back to eating whole real food first and foremost.
Yeah, most certainly agree. I think a lot of the problem too, and you can tell me if you disagree, is that it's just like most people are so heavily consuming these processed oils and they're not consuming the good high quality fats. Like they're not eating the avocados, they're not eating wild seafood loaded with omega-3 fatty acids. So it's almost like, it's not that the consumption is this, it's just the ratios are so far off. And it's almost like if we tell people, hey, eat a lot of seafood, eat these quality animal fats, eat the eggs. If you consume dairy, make it raw, and you're getting in all these good healthy fats that two things happen. Number one, your ratios get better as far as consumption, but when you're eating all this good stuff, you're kind of pushing out the other bad stuff as well. So it's kind of like a twofold, approach that could be helpful.
Yeah, no, I do certainly agree with that. Now we can look at, okay, the standard American diet, right? And, what are the problems there, right? Is it the excess of the processed food or is it the lack of the whole real food? And again, it becomes tough to separate out. You really can't do one without the other. When I'm talking to people about how to modify what they're eating, I do emphasize the positives, right? Eat more of this stuff, right? Eat more animal protein and the fat that comes with it. And over time, you're less and less hungry for the other stuff. And I think that's a better approach than trying to, just cut things out, right? And the real problem we run into, right, is things like meat have been so villainized, right? So when you go to people and you say, you got to cut out that processed food and you got to cut out the sugar and the vegetable and seed oils, and they're like, well, what do I eat? Because I've been told that red meat is going to kill me, right? And eggs are going to kill me, and dairy's bad for me. And they're kind of like, okay, what do you eat, right? So you have to do some of that re-education around the fact that red meat is not harmful for your health. And this is one of the things that I think maybe carries the most shock factor, right? When the heart doctor, right, like ourselves are out there saying, no, red meat is fine for your health. And, you don't have to worry about the saturated fat. This is some of the uneducating that we need to do to get people to a place where they understand, oh, I can just eat whole real food, right? I can eat the meat, I can eat the veggies, and that's what's going to get me to best health.
Dr. Philip Ovadia, he goes through 4 years of medical school. He goes through his general surgery residency. He goes through cardiovascular surgery, fellowship. How often did you guys talk about diet?
Yeah, none. I can confidently say I don't remember one conversation around what patients were eating the whole time during the training, and the superficial education we got around diet in medical school was basically understanding what a carbohydrate is, understanding what a fat is, and the biochemical processes that these things undergo, and then basically some platitudes around the food pyramid and eating low fat diets in the context of disease. But we never talked about what the patients were eating and why it got them there. I certainly never had the sort of realization, right, that I now have on a daily basis, unfortunately, where, for instance, in heart surgery, right, we have known for a long period of time, this isn't like breaking science or anything, right? That the better you control a patient's blood sugar around the time of surgery, the less prone to complications they are going to be, especially infections, right? So we've had these sort of standards of care in heart surgery now for almost the whole time I've been a heart surgeon, so 20 years, that you need to tightly control the patient's blood sugar around the time of surgery. And to do that usually involves putting them on an insulin, IV insulin for the first 24 to 48 hours after surgery. And it never maybe is strange up until a few years ago that you walk in the morning of surgery, after surgery, and the patient's there in the ICU and they have their insulin going and the nurse is, checking their blood sugar every hour. And their breakfast tray comes, right? And it is almost pure carbohydrate because fat is so villainized, right? In the heart healthy diet, you can't have any fat there. So you have your oatmeal and you have your, low fat pancakes, right? And your low fat syrup with the pancakes. And it's all carbohydrates. And we're literally putting the sugar in as we're trying to take the sugar out of the system with the insulin. And it's just, simple things like that, right? That the average eater just honestly doesn't have time to think about. It's not even on their radar. Like you said, we don't mention what the patient's eating, even though it is probably the primary cause of why they're there. And these are the things that we need to start to change in the medical system. And for those people that are looking to stay out of the medical system, right? it starts with what you eat.
Yeah, I was thinking about that, right? Because here we've got Dr. Philip Ovadia, right? And he's a cardiovascular surgeon. And, the guy's like Michelangelo, with his hands. And somebody puts in these four brand new grafts into the person, everything's flowing, amazingly. And you put the person back together again. And now they're in the recovery area. And now it's, day 2 and day 3 post-operatively. And after you've done all that amazing work, you walk into the room. How does that make you feel when you see the stack of pancakes with sugar-free syrup on the person's plate?
Yeah, no, it really, honestly, at this point, it kind of sickens me, right? Patients doing fine eating that food. I can't even look at it. And, more and more I just shake my head. And I have become increasingly outspoken about this. And my patients understand this often, right? And when I operate on people these days, they all get a copy of my book. And I tell them, I don't want you coming back to my operating table. And they now start to recognize it, right? Because a lot of them, they've read it before the surgery. And then they're like sitting there looking at me and like, what's this food in front of me? Why don't we have better food? And so, that's certainly something I'm optimistic will improve over time. And, you mentioned RFK and some of the, at least it's in the discussion now, right? That we're talking about the food that we're eating and the influence that it's having on our health. And I am hopeful that things are going to start to get done about it because the honest truth is we can't continue the way we've been headed, right? We all know how it's bankrupting society essentially and what a big problem it is. And it's time that we start talking about it and start doing something about it.
I think it is a good actually marketing thing that hospitals could do. Like if you're a hospital, you have to outweigh the cost benefits and say, hey, wait a second, if we tell everybody that if you need a procedure done, whether it's a new hip or a bypass surgery or your gallbladder or something on your skin or whatever it may be, like if you come into the hospital here, we're going to make sure you get fed this. So people have a choice very often on where they want to go, and doctors have a choice. This seems like a good opportunity for people. I used to, towards the end of my, hospital career, wrapping up in like 2011, 2012, and I would write in the chart, write in the orders, organic, gluten-free, free-range, grass-fed meat, wild seafood diet. And then, of course, Terry would call me up and they're like, oh, Dr. Wolfson, we don't have that stuff. And I'm like, I know you don't. And that's why I'm quitting. And I can't wait to get out of the hospital system. And kudos to you for making those changes and those recommendations. I mean, listen, cardiovascular surgery can be extremely, extremely lucrative. And, and I'm sure as you found out too, even if you were at those fellows, meetings and you were talking about nutrition, I mean, you would be ostracized. Like your colleagues didn't want to hear that. The attending didn't want to hear that. The, brothers and sisters, who you were training with, who were in the trenches with. That oftentimes, I mean, nobody wanted to discuss that. They wanted to talk about a new surgical technique, right? Or different ways to do certain things or new pharmaceuticals in the case of cardiologists. It just wasn't part of the whole process. And I'm so happy to meet you and know you to see another brother in arms really trying to make a difference, because I think the biggest crime, Phil, is when people like us know the truth, but you like suppress it and you don't share it and you don't teach it or don't acknowledge it. Like that's the real criminal activity.
Yeah, no, I agree with that completely, right? I know how much effort it's taken, right, for me to educate myself on all of this. And I know that's hard. And I know that most doctors don't have the time or, want to put the energy into doing that. And, so I think most of them are truly ignorant, right, when it comes to this stuff, and they just don't think about it. But there are, like you, I do come across some that we start talking about some of this stuff and they're like, oh, yeah, that's how I eat. Right. And I'm like, okay, do you talk to your patients about it? And then they're like, no, and that is harder for me to forgive. Now I understand, right? The system doesn't necessarily treat this kindly, right? It's hard in a lot of ways. And unfortunately, so many of our colleagues are trapped by the system, right? They're employed doctors. They're being told what to do. And of course, we saw this in relation to other contexts over the past few years that when you speak out against something, there's a very real threat that, you could be fired. You could be whatever it is, just told to not talk about that anymore and have no choice but to follow it because, listen, we're all trying to make a living and feed our families and have our existence. And so that is scary for physicians, but I'm hoping more and more that physicians start to talk out about this because I do think it is our obligation as a physician, right? My obligation as a physician isn't to do heart surgery, right? It's what I'm trained to do. I feel blessed every day. I have those skills, but my obligation is to take care of the patient in front of me the best way I can. And we can go back to the Hippocratic Oath, right? It's in there, that we're going to treat, food as medicine. Nutrition, it was one of the first things that Hippocrates talked about in how we should be treating our patients. And we need to remember that as physicians. We need to get back to that we need to do what is best for our patient first and foremost, not what's best for the hospital or our employer or the insurance company. We need to do what is best for that patient in front of us every day.
Yeah, most certainly. And again, kudos to you for making that leap. I mean, there's so few and of us, who are out there, and again, that crime of just knowing the truth. And like you said, I mean, how do you go to work and like you know all this stuff, but you don't tell it to your patients? I mean, it really doesn't make any sense. So listen, your book is called "Stay Off My Operating Table." It is an Amazon best-selling book, tens of thousands of copies that are out there, and that's just changing lives every moment of every day. What are your favorite lab tests to avoid heart attack and stroke? Like, what are the things that you're practicing in your clinic?
Yeah. So for me, really, insulin resistance and inflammation are really the two big areas of focus. The inflammation front, probably C reactive protein. Simple, most labs, a lot of doctors get it, right? They just don't think about it in the right context, but C reactive protein and then some way of assessing insulin resistance. And, this gets a little bit more complicating depending on, what lab you're working with and what your doctor understands or doesn't understand. But if you could just start with an insulin level, right? And if you get your insulin level and you get your fasting glucose level, which every doctor gets these days, and you go online and you plug it into the HOMA IR calculator, that'll give you a sense of your whether or not you're insulin resistant. If you're able to get some more advanced tests, I'm a big fan of it's called the lipoprotein insulin resistance score, the LPIR test. And this looks at the size of your cholesterol particles, right? And it uses that to determine how insulin resistant you are. And that's a great test to help you understand where you stand. Because I do believe that it's the quality of your cholesterol that matters, not the quantity of your cholesterol that matters. And the LPIR test is a good test that helps you to figure that out.
Excellent. If someone is facing maybe a cardiac surgery, what are some steps that I mean, oftentimes you can't prepare for it. It happens, very quickly. But kind of like I mean, let's say someone, let's say someone needs a new valve. You're going to put a new valve into someone, so you got a few weeks, on this, typically or more. How do you prep someone in that sense? How do you optimize someone prior to surgery?
Yeah. So again, if you can identify and start to address the insulin resistance, that's going to be a great way to get started. And, what I usually tell people, eat whole real food, right? And if you're preparing for surgery, you probably want to overemphasize the protein part of this, right? Because protein is great for healing, rebuilding those tissues. And so I'll usually tell people, high protein, mostly animal proteins, eat the fat that comes with it, reduce your carbohydrates. And if we can start to get that insulin resistance under control, that's going to put you in much better shape leading into and recovering from the surgery. As I mentioned, right, your ability to control blood sugar around the time of surgery is one of the most important factors in avoiding complications. And so if we can do that with a dietary approach, that's even better than having to do it with, using high doses of insulin. And so let's get started working on that. And then, again, it's talking to your physician about, okay, not just are you going to fix the problem, right? Because that's what doctors do. We're great at fixing problems, but start to have that conversation around, why did I get this problem in the first place? And that's what I think leads us to these deeper conversations and leads us towards things like insulin resistance, so that we can, again, keep you from coming back from the operating table, or hopefully not have you still die of that disease that we're trying to treat with this operation.
Left main disease, stent or bypass?
I think in the vast majority of cases, bypass, and it's got to stay that way.
Good man, spoken like a true surgeon through and through. Phil, it's a pleasure to speak with you. I could pick your brain all day long and get these discussions out there, but people can go to your websites. I Fix Hearts. You got an amazing book. You got a thriving practice. From what I understand, a beautiful young family. So some great things ahead for you. And again, the pinnacle, we're interviewing the pinnacle right here, cardiovascular surgeon. He's telling you the best ways to stay off his operating table. So thank you again, Phil.
Yeah, thanks for having me, Jack. Really been an honor to participate in this. Your work, you've been doing it for so long and talking about these things for so long. And it's a lot of the work that I've drawn upon and I learned from. So great to be a part of this and connect with you, and great to be on this shared mission with you.
Well, thank you again, because together we're going to just help save a lot of people, a lot of lives. And listen, God bless the men and women who work in emergency rooms and trauma centers and urgent surgeries and stuff like that. But as you know, when it comes to the prevention, treatment, reversal of chronic diseases, the medicine side is nothing. So again, thank you for another wonderful episode of the Heart Attack and Stroke Prevention Summit. We'll see you next time.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.